Ohioans have already received about 1 million doses of the coronavirus vaccine, but that's just the start. And even as more Ohioans qualify to get their vaccines this week, there are still questions and confusion.
Sure is. 5 on your side. Chief Investigator Ron Regan begins our in-depth look at Ohio's vaccine rollout tonight. Ron, you went straight to the governor for those answers.
Well, Governor DeWine agreed to a one-on-one interview to answer questions about the vaccine rollout. We begin tonight with the supply.
We don't have enough vaccine.
Governor DeWine says the nationwide shortage of vaccine is the biggest challenge. 77-year-old Julia Varley is waiting to hear when she will get her second shot.
I've talked to a lot of seniors who are very frustrated.
We have a shortage. There is a shortage.
Well, there's a nationwide shortage, and you know it's a huge problem. I sometimes kind of laugh when I listen to other states and they say, "Well, we ran out." Well, yeah, I mean we run out every week.
According to figures we found at the Centers for Disease Control that tracks vaccinations, more than 954,000 doses have been administered in Ohio. Yet another tracker compiled by Bloomberg reveals just 7% of Ohioans have received at least one dose, appearing to trail neighboring states. Michigan, 7.7%, Indiana, over 8%, and West Virginia, nearly 11%. Why is Ohio not doing as well as some surrounding states?
Well, I'm not sure that's true. I mean, it depends on how you look at it.
Why? It's a snapshot in time, delays in updating, plus thousands of doses are required to be held aside for nursing homes. Health officials caution all three impact statistics.
Let me tell you something that we take great pride in. We have really tried to drill down on who is the most vulnerable.
So we asked the governor about that plan, starting with putting nursing homes first.
54% of all the deaths in Ohio have occurred from people who are in nursing homes. So we know that if we could get people vaccinated in nursing homes, and we have well over 900 nursing homes in the state, we would be going a long way to save a lot of lives.
Thousands of vaccination sites across the state instead of centralized locations. Does that make it just harder to get the vaccine out to all these different sites?
We made the decision to try to go to where people live.
And whether it's working efficiently. Are you convinced that it's getting out to those who need it as quickly as possible?
Yes, we looked at this last Sunday. We had 98% of what we had received were already in people's arms for the first doses.
Finally, confusion over scheduling.
We hope within the next several weeks to have a more central scheduling place. So if you could go online in one portal, and then that would take you to your county and it would show you the places you could go, and then you could go in and make a reservation directly on that portal.
For Julia, she blames the federal government for the lack of supply and slow rollout.
I think further up in the government, if we have done a poor job of getting the vaccinations out to states.
And the governor believes it was best to start with healthcare workers and those over 65 that account for 87% of all COVID-related deaths. I'm Chief Investigator Ron Regan.